Atomoxetine is used to treat attention deficit hyperactivity disorder as part of a total treatment plan, including psychological, social, and other treatments. It may help to increase the ability to pay attention, concentrate, stay focused, and stop fidgeting. It is thought to work by restoring the balance of certain natural substances, neurotransmitters in the brain. How to use? Always take this medicine exactly as your doctor pharmacist has told you. Check with your doctor pharmacist if you are not sure. Atomoxetine is usually taken 1 or 2 times a day, morning and late afternoon or early evening. Children should not take this medicine without help from an adult. If you are taking atomoxetine once a day and experience sleepiness or feeling sick, your doctor may change your treatment schedule to twice a day. The capsule should be swallowed whole, either with or without food. The capsule should not be opened, and the contents inside the capsule should not be removed and taken in any other way. Taking the medicine at the same time each day may help you remember to take it. If you are a child or teenager, 6 years or older, a doctor will tell you how much atomoxetine you should take and will calculate this according to your body weight. The doctor will normally start you on a lower dose before increasing the amount of atomoxetine you need to take according to your body weight. Body weight up to 70 kg, a starting total daily dose of 0.5 mg per kilogram of body weight for a minimum of 7 days. Your doctor may then decide to increase this to the usual maintenance dose of about 1.2 mg per kilogram of body weight daily. Body weight over 70 kg, a starting total daily dose of 40 mg for a minimum of 7 days. Your doctor may then decide to increase this to the usual maintenance dose of 80 mg daily. The maximum daily dose your doctor will prescribe is 100 mg. Adults. Atomoxetine should be started at a total daily dose of 40 mg for a minimum of 7 days. Your doctor may then decide to increase this to the usual maintenance dose of 80 mg to 100 mg daily. The maximum daily dose your doctor will prescribe is 100 mg. If you have problems with your liver, your doctor may prescribe a lower dose. Contraindications. Don't use atomoxetine if you have used an monoamine oxidase inhibitor in the past 14 days. A dangerous drug interaction could occur. Monoamine oxidase inhibitors include isocarboxylate, linezolid, methanoble injection, phenolzine, resagalin, siligeline, tranylcypromine, and others. You should not use atomoxetine if you are allergic to it or if you have severe heart or blood vessel problems, narrow-angle glaucoma, or pheochromocytoma, tumor of the adrenal gland. Atomoxetine has caused stroke, heart attack, and sudden death in certain people. Tell doctor if you have heart problems or a congenital heart defect, high blood pressure, or a family history of heart disease or sudden death. Precautions. Tell doctor or pharmacist if you are taking, have recently taken, or might take any other medicines. This includes non-prescription medicines. Your doctor will decide if you can take atomoxetine with your other medicines, and in some cases your doctor may need to adjust your dose or increase your dose much more slowly. If you are pregnant or breastfeeding, think you may be pregnant or are planning to have a baby, ask a doctor or pharmacist for advice before taking this medicine. You may feel tired, sleepy, or dizzy after taking atomoxetine. You should be careful if you are driving a car or operating machinery until you know how atomoxetine affects you. If you feel tired, sleepy, or dizzy, you should not drive or operate machinery. Side effects. Like all medicines, this medicine can cause side effects, although not everybody gets them. Although some people get side effects, most people find that atomoxetine helps them. Your doctor will talk to you about the side effects. Some side effects could be serious. If you have any of the side effects below, see a doctor straight away. Uncommon, may affect up to 1 in 100 people. Feeling or having a very fast heartbeat, abnormal rhythms of the head, thinking about or feeling like killing yourself, feeling aggressive, feeling unfriendly and angry, hostility, mood swings or mood changes. Serious allergic reaction with symptoms of swelling of the face and throat, difficulty breathing, hives, small raised tissue patches of the skin, seizures, psychotic symptoms including hallucinations, hearing voices or seeing things which are not there, believing things that are not true or being suspicious,